Hello and welcome to webinar series. Myself Shanti. Today we are going to discuss about the basics of heart failure. As ICU senior nurses know it is a very complex syndrome due to various factors, and the impact can be fatal if not treated early. For now, I'd like to welcome our expert panelist, Dr. Aditya Garu. Who is our senior consultant, interventional cardiologist from Yashoda Hospital, Secunderabad. I welcome you, sir, and we are very privileged and honored to have you with us today. Yes, and you can share the slides, Sindhu, and let me also welcome Ms. Sindhuri, who is our senior nurse manager from ICU, and I welcome you, Sindhuri. And the first privilege we would like to ask from your view is, sir, is heart failure a leading cause of hospitalization? In short, yes, over to
Yeah.
you, sir.
So the thing is, if you look at our own hospital data, you will see that a substantial number of hospitalizations are because of heart failure. Now, when I say substantial number, the percentage would be above 10%. Now, the reason is we have an aging population. We have people who are coming to us with in a more sicker condition, and they're presenting to us with more advanced heart failure. Now, the other thing is people tend to think that most of the heart failure patients are admitted to the cardiac ICU. But then, if you observe, if you look at the AMCU statistics, if you look at the statistics from the neuro ICU, then there also you see a lot of patients who also have heart failure. Maybe that is not the presenting complaint, but that is part of the disease. Somebody may come with some sepsis, they may be having heart failure. Somebody may be coming with some infection, there may be an heart failure associated with that. So if you look at pure heart failure, the burden is substantial. In fact, in the US, the most common cause of hospitalization for above age of 60 years is heart failure. So India is also sort of catching up. So if you look at the present trend, especially in hospitals like ours, 10 to 15% of our cases can be categorized of medical admissions would be because of heart failure. The other categories are sepsis and so many other things, but heart failure is primarily a disease also, and maybe associated with many other clinical conditions also.
Indeed, very productive information, as you rightly said. Sometimes we only take the data from the ICU itself, and we forget about the admissions which are happening even in the other non-ICU setup. Yeah, thank you. And sir, one more, insight. Does the prevalence of heart failure significantly increases with the age?
Correct. So in fact, if there is one thing that strongly correlates with with heart failure, it's advancing age. Now, why age becomes a factor is these patients have a lot of comorbid conditions. These patients are sicker. They have lesser, functional reserve, and these patients tend to succumb very early, or they have a very high chance of having adverse events also. So the heart failure as a entity increases in percentage as we grow older. For example, above 65 years, I just told you the statistic. Most of the admissions of people above 65 years, those cases are of heart failure only. So that is a metric. So
So now we'll see again the further discussion with the Sindhu. Over to you, Sindhu, for the rest of the discussion. Yes, take over.
Good afternoon, one and all. It's my privilege to have this session. Let us learn together about this complex topic. So now let's discuss about what is heart failure. Heart's inability to pump blood and supply oxygen effectively to meet the body's metabolic needs. So in this diagram, we can see the reduced volume of ventricular blood supply along with the dilated ventricles.
So I think that heart failure is a very complex condition, and the gap knowledge among the nursing services is a little lacking. So in a very simple way, sir, just can you just tell us how it happens, heart
yeah,
failure?
so this is a very important thing that you need to know, because when people talk of heart failure, people think that the patient would be nearly dying, or he would be very sick, or he needs some ventilator or something. So the impression that people get when we talk heart failure is that patients will be very sick, but that is not true actually. In fact, that is a stigma associated with this problem also. The moment you categorize somebody as a heart failure in the discharge summary, they come back shouting, why are you kept as a failure? So they think that they're just about to die or something is going to happen. That is not correct. See, because heart is predominantly a demand-driven organ. I mean, it has to cater to varying needs of the body. You know, somebody is at rest, somebody is just talking, chatting. The metabolic demands are quite low. I mean, there's no stress at all on the body. But then you're having to walk, you're having to jog, you're having to cycle. The metabolic demands are much more. So then naturally, it is something related to the demand and supply situation. You know, it depends upon
Yes.
how much demand is placed on the heart and how much it is able to meet. So technically, why they have made this distinction is, if you understand that heart failure is a deficiency state compared to demand from the early on, you can catch these patients little early. You don't wait for a situation where the heart has totally become weak, and then the patient is not even able to move his finger also, or is not able to
Yes.
take few steps also. So that is why they are trying to identify heart failure at a much earlier course of disease. It is just like, you're trying to assess somebody like a pre-diabetes. Somebody has got borderline. You don't wait for them to go to 400 sugars. So you do categorize them before itself, telling them that your heart is struggling to meet the body demands. There is some strain that is building up, especially during stress or activity or anything. And then this is an entire spectrum from
Yes.
where patients may have little difficulty in doing heavy work to actually having difficulty in doing light work also, and at the
Yes.
end of it, patient is also symptomatic when he's on the bed also. So that is a spectrum. In all these cases, there is a supply demand mismatch. But whereas in the first case that I told, there is a slight supply demand mismatch. Whereas here, by the time the patient is bedridden, the supply demand mismatch is much more.
Much
Even the
more.
day-to-day activities, even day-to-day, even breathing becomes difficult, even eating becomes difficult. So that is the spectrum. That is why it is important to understand that heart failure is nothing but a deficit in terms of the metabolic demands of the body and the heart's ability to meet it. It may
Yes.
extend from very mild forms to very severe forms. So that is
Yes.
how you have to understand heart failure.
Yes.
A few common symptoms of the heart failure: the shortness of breath, fatigue, fluid retention, and edema. The causes are ischemic heart disease, hypertension, valvular disease, myocarditis, coronary artery disease, and chronic kidney disease.
So, sir, when we are talking about few symptoms, we have just quoted as a little like few symptoms, and why the retention of fluid happens in the body, like fluid
So,
buildups. It's
so
just because it
basically,
is retained in the lungs and entire body, and then patient comes with a generalized body edema. And
correct.
are these the causes? And with the presence of comorbidity, also heart failure becomes it becomes worse. Yes, your insight about this thing.
Yeah, so ultimately now what will happen if the heart is not able to meet the demand? We are not going to
Yes,
sit idle, no? People will still keep doing what they want to do, or people will keep
yes,
eating what they want
yes,
to eat. Now, what happens as a result of that is the heart is pumping lesser blood. So the kidney senses that it has a sensor mechanism. It detects that the blood that is coming into the kidney is low. So it has to do something about it. It has to make sure that the filtration does not stop. So what it does, it starts secreting hormones. That is what we call the renin, angiotensin, aldosterone
yes,
system, in such a
yes,
way that the fluid starts retaining in the body. I mean, it needs to maintain that. See, because the heart is not pumping, enough fluid is not
yes,
coming to the kidney. The kidney has to do
yes,
something about it. What the kidney does is it starts retaining fluid into the body. I mean, it starts avidly absorbing water. So instead of pushing out the extra water, now the kidney has started to build up the water because it has
accumulates. Yeah,
detected a drop in the blood flow.
yeah,
The kidney has detected a drop in the blood flow. That is why this compensatory system kicks in. The body's compensatory system kicks in, and then the fluid starts getting built up. So that is the problem. The retention of fluid, because of the renal compromise. The kidney is getting less blood supply because of low cardiac output. Now the kidney detects that the vascular supply is low, it's running low. So what's natural reaction is to start harboring fluid. Now what happens, even if you have seen, even if you don't drink water, say for say 7 or 8 hours, what happens? The urine starts getting concentrated and concentrated. That's
yes,
the kidney's normal response to
yes,
low volume. That is how it is designed.
yes,
So what it does, it does not allow urine to go out anymore. I mean, it starts concentrating the urine. That's how the kidney works. It will detect that the blood is low and it will start concentrating the urine. That's the normal thing that we see.
normal
We don't drink
result.
water for a long hour.
Yes.
So in the heart failure situation, the same thing, the kidney thinks that the same thing is happening to the kidney. So
Yes.
low blood flow to the kidney, it detects that something is wrong with the body. Now let's make sure the water does not go anywhere, because water is key to survival. So it will start retaining the fluid. So whatever extra fluid that you see is because of the kidney overacting, or it's trying to compensate for the loss of volume from the heart. So that is why edema is a common, and all other symptoms that you see. Suppose the now the fluid, it has to stay somewhere. I mean, where
Yes.
is the space? Obviously, your skull is a tight space. You cannot
Yes.
retain any fluid there. So what, it's a bony thing. So wherever soft tissue is there, the fluid tends to get
It
accumulated there.
builds up there. Yeah.
So say your feet or the lungs. The lungs are large, roomy places. You can accommodate many liters of fluid there. So the for fluid tends to get distributed in the so-called third spaces, where it is not usually there. So that is why you see those puffed up faces, and
Yes.
the patient is breathless, the feet are swollen. So that is the reason why edema is one of the most apparent symptom to a person.
Yes.
If somebody walks in, some relative walks in, he says that, "Hey, your feet are swollen, you look puffy. What's wrong with you?" So that is why edema is one of the common presentations of say heart failure. Then likewise, some people feel fatigue. Cardiac output is low. They don't feel any energy. Even if they do something, they get tired. So they get sometimes sort of irritable also.
Yes.
That's another symptom
Yes.
of heart failure. So again, breathlessness. Again, the lungs are flooded with fluid. Any increase in demand again leads to more damming of fluid into the blood, into the lungs, worsening the SOB situation. So these are the classical heart failure signs.
Symptoms.
So that
Yeah.
yeah.
So,
Then
sir,
above
these
the
clients,
reasons that you have given, like Sindhuri has given, ischemic heart disease is the most common. You see, we have
IHD.
a high burden of heart disease.
Yes.
They have triple vessel disease. The heart is getting very less blood flow. They're having heart attacks. The heart is getting damaged. So all those cases that we are dealing with, we are putting stents and we're trying to improve the blood flow. But then by the time they come to us, a lot of damage would have already occurred. So that is what ischemic heart disease means. Then the other thing is hypertension. A lot of people have uncontrolled hypertension. People don't pay attention to that. So hypertension poses a very severe strain on the heart, because it has to work under very high loads of what do you call. See, suppose if it's pumping at 120 by 80, it's very easy for the pump to work. Suppose it's pumping at 180 by 90, that is 24 hours a day, 365 days. The strain is much more. That is why hypertension is an important cause of heart failure. Other conditions, valvular heart disease, myocarditis, they're all, little less in incidence. But if you ask me, most common two causes of heart failure are ischemic heart disease and hypertension.
Hypertension. Yes. Yes. Very productive statement. Yes. You could clear a lot of doubts. So, yes. Over to you, Sindhu. Yeah.
Yeah.
So, sir, again, yeah, as you rightly said, are lifestyle factors responsible for this condition, like smoking, obesity, physical inactivity by default, and poor dietary style, and about again excessive alcohol consumption? In short, your insight on the same.
Yeah, exactly. I mean, this is where your story starts. I mean, why do we get
Yes.
hypertension? Why do we get diabetes? So ultimately, these are poor choices on our part. The way we eat, the way we spend our energy, and smoking. It's a stimulant to the heart. The nicotine spikes up the blood pressure. Obesity, over a huge body mass, the heart has to struggle to pump blood to a much larger
Blood.
body mass.
Yes.
So
Yeah.
these are the first steps towards, it's the story starts here, goes
Yeah.
on to become hypertension and diabetes, then goes on to affect the heart, then goes on to cause heart failure. So this is where these are the first steps towards heart failure, actually.
Yes. Yeah, and I think we have already spoken about the age group. What age group is most susceptible, as you said, above 60, and maybe see somebody like below 60 also. So
Yeah.
maybe your clients who reports
So,
to.
so the only thing is the reasons are little different for the definitely the age group that is affected most is the elderly. There's no doubt about it. But
Yes.
then it is not like as if the younger age group is not affected totally. Somebody is in the middle age also heart failure can become a problem, especially if they have had coronary artery disease at a very young age. People have blocks, say in the 40s and 50s. The heart is damaged. They continue to live with heart failure for many decades. So that is one of the most common. Premature coronary artery disease is one of the causes of premature or early heart failure. Hypertension, again, much neglected subject. I keep seeing patients with hypertension. They don't take medication. They'll end up with heart failure in 2 to 3 years' time. That is another major cause of heart failure in the younger age. The causes may be different. The younger population is sometimes more affected with what do you call myocarditis. Again, viral infections
Myocarditis,
that
yeah.
that we have seen in COVID also. The viral infections affecting the heart. So
Yes.
they are also not totally away from heart disease, but they also nowadays the obesity has become a problem. Premature hypertension, diabetes, viral infections, sometimes rheumatic heart disease. That is another cause of heart failure, especially in the villages and all. A lot of patients have rheumatic heart disease. There's a valvular damage to the heart because of rheumatic fever. Then they go on to develop heart failure. So
Yes.
in terms of incidence, elderly is more, but in terms of causes, they're a little different compared to the elderly.
Little different case to case, yeah.
Here, let us understand the types of heart failure. So here mainly we have three types of heart failure. The one is right-sided heart failure. It means the right ventricles cannot effectively pump deoxygenated blood to the lungs. The second one was left-sided heart failure. It means dysfunction of the left ventricle result insufficient delivery of blood to the vital organs. And third one is the congestive heart failure. It is a chronic condition. Heart does not pump blood as well as it should. So in this 2-day echo report, especially we will monitor the EF. So EF means measures the percentage of the blood pumped out of the left ventricle of the heart with each contraction. So the normal EF typically 50 to 80, 70%. It's around the 50% also.
So, sir, we were trying to just a little bit understand when we were making this PPT. It was little, little hard for me to just understand this. And Sindhu shared the other slide also, number 9.
Yeah.
So these are the types of heart failure, like congestive right and left. And does CHF manifest for left and right, sir? Yeah, maybe
Yeah,
in a
so
simplified version, you can tell us.
correct. So, it's basically when we talk of heart failure, it can mean left ventricle, right ventricle, or both. So it is like that. So most commonly, it is the left ventricle which is damaged first. Most common causes of heart failure, if you just go by the incidence, left ventricle tends to get damaged first because of the blocks or whatever, hypertension and all, because the LV takes the brunt of the injury. Then
Yes.
as the left ventricle fails, naturally the right ventricle pumps blood into the lungs. We have just discussed that the lungs also become congested. So now the right ventricle also starts taking the load of the congested lungs. So over a period of time, the right ventricle also starts getting affected because of the increased load. And eventually both the ventricles are not working properly. Starts with the left ventricle, then the right ventricle is involved. Then that's at that stage we call biventricular failure. Or so that's how it happens. Now there is pure right heart failure also, but let us not discuss it because it's not that very common. Most commonly we encounter is the left ventricle or biventricular failure. That is the most common
Biventricular.
situation that we
Yes.
see. Pure right ventricular failure occurs in some conditions which are not very common. I mean, we can say they account for around 5 to 10% of cases where only the right ventricle alone is affected. No, so there may be some genetic cardiomyopathies, there may be some chronic pulmonary embolism, pulmonary hypertension leading to right ventricular failure. So that is a small group, but most common is the left ventricle getting damaged, and consequently, over a period of time, the right ventricle also getting damaged. So that's what we
Right.
need to understand. Now, what are the symptoms of right ventricle failure? So because the right ventricle is in direct connection with the venous system, if the right ventricle is also affected, then you see edema on the feet and all. If the left ventricle alone is affected, then you see usually patient has breathlessness as a symptom because the lungs are affected first, and in the first instance, like the X-ray that you have shown, you can see the lungs are pretty white, especially
Yes.
the lower zones of the lung. They are pretty white. That's all pulmonary edema. There's all fluid in the lungs.
Yes.
So the patient predominantly presents with breathlessness or dyspnea if they have only left ventricular involvement. If they have biventricular involvement and also biventricular involving the right also, then they'll start having edema, the legs and all, abdominal distension, the stomach is bloated, the edema
Ascites,
is there. So that is all. Those are all features of right ventricular failure. So,
yeah.
like I said, usually right ventricular failure does not occur on its own. It is a consequence of left ventricular failure as a second development. Yeah.
So here we can see a condition known as systolic and diastolic heart dysfunction. So in this heart failure with reduced ejection fraction, also called as a systolic dysfunction. In thus, heart ventricles are unable to contract effectively. And the second one, heart failure with preserved ejection fraction. So this is also known as diastolic heart failure. So in these, heart's ventricles become stiff and unable to relax.
So, sir, as you rightly explained to us, a reserved functional flow and the preserved one. Yes. And sir, even we want to understand from you, like as you said, heart failure at young age and after 60. Are these clients they able to recognize these symptoms like SOB, fatigue? Maybe a lady who works in a domestic wife and she may be experiencing that a lot of extreme fatigue is happening. So let me not seek the doctor. Coughing or wheezing, maybe they think that there is a lung infection and all. What is happening, sir? Do they report to you when they are subjectively all right? Yes,
So the
and
most commonly, people, heart failure patients, people are able to recognize with the edema only. I mean, they come mostly with me to edema. Most people are aware that that's an alarming sign. That something is wrong. They think something has gone wrong with them. So that is something which they will not miss. The other symptoms like breathlessness, fatigue, weakness, people tend to get confused with other things also. It is very hot, or I'm not eating properly, or
yes, yeah,
the food. So they tend to get confused. It's not so easy for a person to immediately think of heart, because they will think of more simpler things. They won't, it's a natural tendency. But the only way to understand this is symptoms that are prolonged in nature, that are getting worse with time. One needs to consider a chronic ailment that is affecting one of the vital organs of the body. That's how we have to understand. See, all other illnesses, say you say post-viral also, you may feel fatigue, or then
yes,
also you may feel. But then all those things you would recover over the next, say, few days or few weeks.
yeah,
But then an injury to the heart is something which will not recover like that. It will keep getting worse only. So we need to convey to patients that if you have these symptoms, like breathlessness, fatigue, and all for a long time, it's better to consider, and also worsening over a period
yes,
of time. So that is where an observant patient will be able to understand that better. Somebody who is active, say he walks 5 kilometers, 2 to 3 kilometers a day, then he feels, before I was able to do it well now, but now I'm not able to do it, or I'm finding it difficult. So one is the chronicity of the condition, that is the duration of the condition, and worsening. These are the two things that can give us some clue towards a heart issue.
So his stages of heart failure as SAC and AHA. The stage A, at risk for heart failure, this is involved in some family histories and comorbidities and other health issues. In stage B, pre-heart failure with the pre-heart failure symptoms. And stage C, symptomatic heart failure that involved with the medical treatment along with the minor procedures. In stage D, advanced heart failure, this is involved in the complete heart transplantation and other palliative care.
I think this is we just
Yeah, we,
quoted
we
this.
have covered this part.
Yeah, yes, we have done.
So yeah.
Yeah.
Here, few investigations as per patient condition we are performing. The radiological investigations are chest X-ray, ECG, and echocardiogram. The blood investigations are NT-proNB, TROPI, and CBP, RFT, and electrolytes.
And furthermore, sir, do you in what stage your interventional procedure can be performed in heart failure, sir?
Yeah, so regarding the test that you have shown, that
That's
is
right.
so these are markers of cardiac injury or cardiac
Yes,
stretch. NT-proBNP tells us about the condition of cardiac stretch. We have discussed that a congestive heart failure, where the heart is getting dilated and all, the heart muscles start getting stretched. So the NT-proBNP is a reflection of the cardiac stretch. So that is one of the clues towards heart failure. Troponin is an indication to indication to show that the heart is, what is the level of injury to the heart. ECG, ECON, we have seen that they help to categorize what kind of heart failure we are seeing. EF, like we have, so that's where the echo helps. Sometimes also the cause of heart failure. We may get some clues from that. So this is so far the diagnostics are concerned. So the interventions are of two types. One is, like we have discussed, ischemic heart disease is a common cause of heart failure. So whenever we find that coronary arteries are obstructed, so we try to correct those obstructions, improve the blood flow to the coronary arteries. Either we do a stenting, or the patient undergoes a bypass. So we improve the blood flow to the heart condition might improve. So that is one level of interventions that are possible. The second level of interventions are some electrical interventions. For example, the heart has become weak. The conduction system within the heart is not functioning properly, so that worsens the myocardial problem. The electrical depolarization is not correct. So in some of these cases, we suggest them some pacemakers or something that can try to improve the condition of the heart, the pumping of the heart. So these are some of the interventions that we do. That is, first is improving blood flow. Second is considering devices like pacemakers. And one important device for the heart failure patients is an ICD, that is implantable cardioverter defibrillator. So patients with very weak hearts are susceptible to sudden cardiac death. They may have no sudden cardiac deaths. So and in hospital, if somebody comes, we are able to resuscitate them. But suppose the same thing happens in the house, they may die suddenly. So these are the devices that we offer these patients.
Yes. Yeah. And Sindhu, we can just talk about your nursing, care, and then we are just, coming towards the end of this session.
Yeah.
Yes.
Here, the care of patients with heart failure, basically the vital parameter we should monitor. So in this, mostly we will observe the bradycardia and the hypertension of the patient that should be monitored and escalated immediately for the treatment and all. So carefully fluid and electrolyte balance we should be for preventing the fluid overload, already as Aditya sir discussed. So here the medication part, 4 pillars of medications we administer for heart failure with the reduced ejection fraction, that was an ACE inhibitors, angiotensin, converting enzyme inhibitors, and glucocorticoids, mineralocorticoid, and SGLT2 inhibitors. As per patient required, we need to administer the oxygen and strict maintenance of intake and output chart. In diet, we need to maintain a low sodium diet.
Yeah, and I think these are the high risk medications, and one should cross check with the other nurse or the doctor who is available in the ICU. Yes, I think, and nurses should wondering, do you monitor for few red flags into? I think yes, your ICU nurses and escalate these parameters to the doctors, and they would be this, as sir said, if at all they observe by SOB or any deviation in vital parameters or anything like that. Yes, I think yes, this has been trained to all your nurses. Yeah, in such emergency scenario, I think we always need to keep our crash cart and defibrillator, everything ready. Yes. Yeah, we are close to the heart health to be protected by all these parameters, as sir also rightly said, cessation of smoking and quitting about the alcohol consumption and all that. Physical state of exercise is very mandate, and yes, we would like to thank the viewers. Thanks for watching, and we do a lot of academic activities. So please do connect with the www.yashodahospitals.com, and please try to take the pledge to protect your heart, and do connect with the social media. These are all our social platform where we always publish a lot of our academic events, and I think we are done. And thank you to all the viewers. Thank you, Sindhu, for your participation, and thank you. We leave the session. Yeah.
Thank you.